Hello, Dr. Vicki Peterson here. One of the most common questions I'm asked is what to do after the diagnosis. So you've been diagnosed with celiac disease, you've been diagnosed with gluten sensitivity, maybe you were diagnosed via a lab test or a biopsy, maybe in the case of gluten sensitivity you figured it out yourself, but then what? Very often what occurs is that an individual feels much improved once they remove gluten from their diet. But sadly, that improvement is often short-lived. And what occurs is that symptoms start to return. At this point, patients wonder if they're inadvertently cheating, if gluten is making its way back into their diet somehow. And I find that in most cases, that's not really the problem. Those who are really trying to be perfect are pretty darn good at it. They read labels. We don't have the issue of labels not containing gluten if they have gluten in them. We don't have the issue of not knowing whether a facility is a dedicated gluten-free facility or not. I mean, we have that ability. Certainly when you go out to eat, that's another issue because there's cross-contamination and what are they doing in the kitchen, and that can definitely be a problem. But that aside, food that we purchase is usually pretty safe. And the question is, what happens? Why did I feel good initially and now I don't? So the term we have coined here at Health Now is the secondary effects of gluten. And I refer to it a lot because it's a very, very critical step. Obviously, the number one step is, am I gluten intolerant or not? Once that has been established, really there is no success rate or a very, very small success rate if we don't then address the secondary effects. So what do I mean by that? You've been eating gluten regularly, probably prior to your diagnosis. What's happened is your immune system has been attacking that gluten, and whether the attack was more in the GI tract or it was more in the nervous system is not really relevant. The point is that your immune system has known about this foreign invader and it's been trying to rid the body of it, and it's really exhausted the immune system. And because you eat and your food goes into your small intestine, and the fact that most of your immune system is housed in your small intestine, about 80% of it, that's the area that really takes a beating. And do realize that what's quite interesting about the small intestine is it's the gateway. It allows good food to enter the body. I mean, you feel like as soon as you put it in your mouth, it's entered your body, but it hasn't really. The tube that is the small intestine is really apart from the body in many ways, and the body allows entry of things that are good food, good nutrition. And very much in the opposite way, the small intestine prevents bad guys, or at least when it's healthy, it does. It prevents bad guys from entering the body through the bloodstream. It's supposed to either destroy them in the small intestine itself or excrete them. So that's kind of the brilliance of the small intestine and what it does. So getting back to these secondary effects, you eat gluten, and your immune system gets very depleted because it's constantly battling this gluten that's coming in. And one of the secondary effects is that these bad guys, these parasites, amoebas, bacteria, what have you, who do commonly enter our small intestine, granted they're supposed to be destroyed in a healthy small intestine, but now the immune system is depleted, they're not destroyed, they gain a little foothold in the small intestine, and then what occurs is you have a nice infection. And these infections are, we tend to call them hidden infections because you're not running a fever, you don't feel acutely ill. These guys have gotten a foothold and they're creating symptoms, but not the symptoms you would necessarily think of when you think of having an infection. Once again, you don't have a fever, you're not feeling acutely ill, you're not feeling great certainly, you're not having diarrhea, usually in most cases, so it doesn't really fit the mold, and that's why a lot of times people don't look for them. So that is a big one we find in our clinic, is that in order to get that immune system healed, you have to realize you've taken away gluten, great. that was really an assault on the immune system. But now we have this hidden infection. That's also an assault on the immune system. So we have to identify it if it's there and remove it. Then you have the good guys, the probiotics. They're supposed to be very robust. They help keep bad genes turned off. They keep us healthy. They do a myriad of wonderful things for us, and they can get depleted with the immune system getting depleted, so maybe they need to get built up. We can figure that out. There's testing to look at the probiotics. There's testing to find the hidden infection. Maybe you have a dairy sensitivity. It's a very common food sensitivity in a lot of people, let alone people who are gluten intolerant. There's also a test for cross-reactive foods that I have talked about in the past, but these are foods that their protein structure kind of mimics gluten, and because the immune system, once again, that's our theme, the poor immune system, but because the immune system has gotten beaten down, it's actually confusing one protein for another protein because they're so similar. So the body sees corn, and that protein is similar enough to gluten, and it has the same reaction when you eat corn as if you were eating gluten. Now, most of those cross-reactive foods are not permanent, so don't get depressed. So we do the test, we find out if they're there, we take you off of them for a few months, and then we reintroduce them. And while we've taken you off of them, we're building and healing that gut, okay? What else? There's toxins. Maybe you've had a heavy metal exposure, or you have had Lyme's disease, or you have Lyme's disease. Certainly the toxic load or the Lyme's disease is a huge strain on the immune system. There are frank nutritional deficiencies and enzyme deficiencies that occur secondary to being gluten intolerant. So that's kind of the list right there. It's not that many items, but they have to be looked at. And with the result being we have a strong immune system and we don't have a leaky gut anymore. That's our end goal. And I wish that just removing gluten was enough to accomplish that, but it's not in 90+% of the patients. There's a few lucky people, they remove gluten, yay, everything's great, and that's the end of it. But for the vast majority, it's not enough. So understanding those secondary effects and really making the effort to go that next step is very, very critical. Very, very, very critical. So if you need help with that, that's what I'm here for. I can certainly help steer you in the right direction. And please share this with those you know who might be suffering. And until next time, I wish you very good health.